I'm Steve Cleves. I'm an internist, which means I'm a primary care physician for adults. I think primary care is without a doubt the greatest job in the world. I get to meet all kinds of interesting people. I learn about them. I help them through their journey of life. What I like to say is I laugh with my patients, I cry with my patients, and unfortunately sometimes I go to funerals for my patients. So I feel like I've been with them all along the spectrum of their lives. I've been very lucky through my career, and I've found primary care to really be a very wide-ranging series of things that I take care of. My real specialty is I've been able to mix things I love with primary care. For example, I grew up in Cincinnati in the 70s with the Cincinnati Reds and the Big Red Machine, and for the last 20 years, I've been the primary care physician for the Cincinnati Reds. Also, I graduated from Xavier University, so I'm a true blue Xavier Musketeer, and I'm also the medical director at Xavier University. So I've been able to mix what I do in primary care with some of the things that I truly enjoy in my private and personal life as well. Choosing a primary care physician is all about relationships. You need to feel comfortable with someone, you need to trust their judgment, but more importantly, it's someone you need to be able to open up to. If you have a question that seems a little embarrassing or a little unusual, you're not going to ask that to someone who you don't feel like you have a relationship with. So that relationship is really the cornerstone of what we do in primary care. I'm comfortable asking my patients uncomfortable questions. I want them to feel the same way about me. The best part of my job is the people. I get to meet people from all walks of life, as I said earlier, and I'm actually now far enough in my career, I'm on fourth generation families that I've taken care of. So it's really neat to be able to know that I took care of your grandmother or your grandfather or your granddaughter and just be able to kind of bring all that family tie together, which is what I do all day long in the office. You know, the frequency of visits really depends on the individual person, whether they do or do not have medical problems. Certainly an annual physical is very important. That's where we find out if somebody has an undiagnosed condition, if they're kind of easing their way into some chronic medical condition such as diabetes or hypertension. So at least once a year, and then certainly if people have ongoing medical problems, those could require closer follow-up. TriHealth is a great system where we have lots of specialists across lots of different physical locations. So we've really tried to embrace the technology at TriHealth as best as we can. I can email, I can text, I can get an answer from a specialist, as quickly as I need to. It really has worked very well. It's pretty seamless if you learn to embrace the technology. The decision to choose a TriHealth primary care physician is really at the forefront of what someone wants to do for their health care. We have an incredibly large system with an incredibly large talent pool, and I feel very confident that if I were choosing a primary care physician based on my interests, my desires, my preference of male versus female, there are more choices within TriHealth primary care than anywhere else in the city of Cincinnati.